Let's get itchy. We're going to talk about pediculosis, scabies, and pinworms. So, parasites are organisms that are larger than yeast or bacteria, and they can cause infections. They live in us or on us. They get their nourishment from the host without helping us or killing us. Um, Parasites that are frequently seen in children are like scabies and head lice. Pinworms is a parasitic intestinal worm that's called a helminth. Helminth. Helminthic infections are seen in kids, including pinworms, roundworms, hookworms. They all sound disgusting. Kids are at a higher risk for parasites and helminths because they are really gross. They're dirty, dirty little finger sucking, booger picking um, babies. Yeah, so think about that every time you see a little boy eat his boogers. Um, Pinworms, scabies. Yeah. So so kids are more careless about hand washing and they tend to put a lot of things in their mouths and share toys and objects, and that's not that's not great. Okay, lice, which is also known as pediculosis capitis when it's on your head. We tend to find it most frequently behind the ears and at the nape of the neck because that's where kids are scratching the most. Um, I've included pictures of the actual lice themselves on probably a piece of napkin, as well as the nits. So the nits are what we are trying to remove, and those are the eggs. The treatment that we're going to have is pyrethrin, permethrin, and a healthy long period of sitting while somebody scrapes the eggs out of our head with a weird little comb. The management is contact precautions if they're in the hospital setting, and we need to educate families to clean and remove any personal items. Most of the time after they've been treated, we have to remind parents to check the hair and comb the nits and lice from the hair shafts every 2 to 3 days so that we prevent reinfestation based on the life cycle of the lice. Some of the control measures that we can educate families about is that household and other contacts need to be examined, and if they have an infestation, they need to be treated. Anyone who sleeps in the same bed should be treated prophylactically, whether they have a visual diagnosis or not. Head lice don't survive very long once they've fallen off the head. Most children can get treated effectively without treating their clothing or their bedding, but to help avoid reinfestation, parents should disinfect clothing, any headgear like their earbuds and like the Beats headphones and pillowcases and towels and other items that have been used within the past 2 days by the infected individual. They can disinfect by washing it in hot water and drying it on the hottest cycle, or dry cleaning any non-washable items. If people don't have access to dry cleaning or washer and dryers, they can just seal it up in a big plastic trash bag for like 10 days, but they have to really seal it. And at that point, they'll be dead because, like I said, they don't live very long off of a human host. We want to tell families to soak the combs and hairbrushes in a pediculicide shampoo or really hot water. Um, School is an issue because schools are the place where the lice is getting passed around. Um, Lice don't jump, they don't fly. Anyone who says they have seen flying lice or jumping lice, it wasn't lice. So they don't jump or fly, they have to crawl from one surface to another surface. So the way that our kids are getting infested and sharing that infestation is when they're in school and their chairs are butted up against each other and everybody's hanging their hoodies and their backpacks, which is all touching the nape of their neck. Um, they're hanging them on the backs of their chairs, and then those are touching. And the lice is able to crawl from one backpack or hoodie to the next. We also have cubbies, which is not great. Kids are all stuffing their hoodies and backpacks into cubbies, or they're hanging them on little hooks, and the hooks are so close together that they're just all touching. Plus, little girls share hairbrushes, boys share hats, and everybody sticks their head together to take selfies. And yes, school-age kids are taking selfies. So try to keep uh, that under control. Also know that the American Academy of Pediatrics says you absolutely should not keep your child home from school because of lice. It is not something that kills children, so they shouldn't be kept home from school. It's not a public health hazard, it's just a nuisance. Also, please understand that lice infestation is not a sign of poor hygiene. Every single socioeconomic group can be affected. It doesn't matter who you are, where you live. If a lice can get on your hair, it's gonna. So judge all you want, but don't do it to your patients. All right, scabies, which is called Sarcoptes scabii. It's so pretty. Um, I love the little picture of the scaby itself here because it just looks like a weird little fat elephant bug. But not the picture of the baby, but the other picture that looks like just a line. That is a typical entrance point and poop trail of a scaby under your skin. And I'm itching right now as I talk to you about it. So the places where the scaby tends to burrow under the skin is we usually see it like in between the fingers or toes or running up the wrist. They really like to find their way into warm, moist regions like armpits and groins. And then they cause severe, intense nighttime itching. They're going to itch all day at some point, but it's always worse at night. So that's a cue that we look for. What's really disturbing about scabies is that the incubation time without symptoms is around 4 to 6 weeks, but it's highly transmissible. So transmission is occurring with prolonged close personal contact or sexual contact. So if your sexual partner has scabies and you don't know it and they don't know it, and then you have a child or a baby and you are holding that child or baby and sleeping with that child or baby, you are passing scabies. So just touching somebody one time does not a scabie make. You cannot get scabies infestation from touching. It has to be prolonged close personal contact. But like I said, the incubation period is 4 to 6 weeks without any symptoms. Oof. The diagnosis is usually made by history. We see the classic rash, um, the signs of the burrowing, and usually within the burrowing you'll see little black spots, which is like the poopy leftovers mixed with blood. What they're doing is they're crawling under your skin and they're laying eggs. Um, they can also, to diagnose it, take skin scrapings and look at it under a microscope. The treatment is going to be the same as for lice, except it's on the body. So we're going to use permethrin, malathion. If those sound like pesticides, it's because they are. Just like with lice, we're going to usually do a repeated treatment. So with lice, we're going to do a repeat treatment within 9 days. With scabies, we're going to do a repeat treatment for the body within 1 to 2 weeks. We want to make sure that families know that the itching can continue even after the scabies are gone. So itching isn't necessarily a sign that it's poorly treated. The management is contact precautions and prophylactic therapy for household members and any sexual contacts. Any bedding and clothing that's used by an infested person or household needs to be laundered in really hot water and dried on a really hot cycle. The mites themselves, the scaby mite, it can't survive more than 3 to 4 days without skin contact. So removing them from a place where they could contact the skin is the easiest way to get rid of them in a household. We're going to educate people to avoid direct skin-to-skin contact with anyone or person or items that may be infested. And the room used by an infected person, especially if they have like crusted over scaby areas, should be thoroughly cleaned and vacuumed. Okay, this is the last really grody one. Hopefully this one won't make you itch as much, but it's just as gross. So, pinworms. It's a helminth. It is known as Enterobius vermicularis. It's a roundworm, and it is found in tropical and temperate climates most commonly, it is the most common helminthic infection found in the United States. So a lot of kids, at least when we used to play outside, we all got pinworms. I have vivid memories that I can tell you about. There are some people who are asymptomatic, but not everybody is. Most of the time, it causes severe anal itching that's worse at night. So if you can envision the child who constantly has their finger up their nose and then their hands in their mouth, and when you watch them at the playground or on the school campus, they have their fingers halfway up their butt, scratching and scratching and scratching all the time. That is because they're itchy. And fecal oral route is either directly, indirectly, or inadvertently with contaminated hands how we spread this. It can be on shared toys, bedding, clothing, toilet seats. Ah! The incubation period is like 1 to 2 months or more. So I've included here not only a picture of the eggs, but also of the actual pinworm themselves, which are very, 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 very tiny. They used to call them thread worms because they just look like little threads. So I've included the life cycle. So basically, there is eggs, on the perianal folds. And there's larvae inside those eggs that then mature within 4 to 6 hours. So let's say that whoever had the eggs floating around on their perianal folds was the kid at the playground who is constantly digging at their butt. And then they go and play with a toy, and then your child touches that toy, and then your child puts their grody little fingers in their mouth. Now, the eggs that are already embryos, they're not fully mature, but they're embryos, they're ingested either through the nose or through the mouth. And then it goes down into the small intestine, and that's where the larvae hatch. And then they become adults, either female or male, inside the cecum. And then they have a party and have much sex, and they become pregnant, migrate to the perianal region, and they lay their eggs at night. So, this is all so wonderful, right? The best way to find out if the kid has pinworms, because usually you don't find eggs in the stool, and if they're at the point where the poop actually has pinworms visible in it, it's pretty bad. So what they historically have done is told parents to wait until very early in the morning, like 3, 4 o'clock in the morning, and to put tape wrapped around a tongue depressor and stick it in between the butt crack of their child, and then hold it there until the worms get stuck to it. And then when you pull the tongue depressor and the tape off, there's pinworms stuck on the tape. And I have a vivid memory of my mother doing that to me when I was very young. Fun. Then they take you to the doctor. They're gonna maybe give them the taped specimen, and they're gonna look at it under a microscope, and if there's eggs there, then they're like, oh no, we've got to treat them. So usually we want 3 consecutive specimens that are obtained when the kid is first waking up or right before it. We treat using, and I gave you the names of the meds down here. All of this is in chapter 37 of your text, but it's mebendazole, pyrantel pamoate, or albendazole. And those are usually given in single doses, and then we repeat it again in 2 weeks, just for any of those larvae that we might not have gotten yet. For pinworms, standard precautions are fine. So, like, just gloves. Reinfection does occur really easily, and some of the education that we're going to give to families is that anyone who has an infestation of pinworms should bathe, usually with a shower, because a bath, you're just going to be sitting around in a tub full of worms. So take a shower in the morning and wash between your perianal folds. And that's going to help remove a pretty good portion of the eggs. And then we want them to frequently change their underwear and their bedding. So every single day, the underclothes and the bedding should be changed out and washed on high temperatures. We want those kids to have good personal hygiene, which we already know they don't, because they're booger picking, they're butt scratching, and they're putting everything in their mouths, and they never wash their hands. So keep the fingernails short, don't scratch the perianal area, and tell the kids to get their hands out of their mouth and out of their nose. Stop it. Don't bite your nails. Nails is one of the places you can find all of this because the pinworms live in dirt. Ugh. So, good hand hygiene. It's the best and most effective preventive measure, especially after using the bathroom and before eating. Every single family member should be treated because transmission from person to person is very easy. And like I said, it can be like a month worth of incubation. So just because you think you don't have it when your kid has it, you probably have it. And that is all of the grossness in a nutshell. Enjoy.